Do you ever feel down during certain seasons of the year? Let's talk about a phenomenon that affects many, yet isn't as widely discussed as it should be. This is known as Seasonal Affective Disorder, often abbreviated as SAD. It's a type of depression that comes and goes with the seasons, typically starting in the late fall and early winter, and going away during the spring and summer. Some of the common symptoms include feeling depressed most of the day, nearly every day, losing interest in activities you once enjoyed, having low energy, and experiencing changes in your appetite or weight. Now, it's important to note that it's normal to have some days when you feel down. But if you feel down for days at a time and you can't get motivated to do activities you normally enjoy, this could be a sign of SAD. If you're nodding along, you might be dealing with something called Seasonal Affective Disorder, or SAD. You may wonder why some people experience SAD, while others do not. The science behind this condition is quite fascinating. It revolves around the concept of our body's internal clock, also known as the circadian rhythm. This rhythm is largely influenced by sunlight, helping us distinguish between day and night. As the seasons change, daylight hours become shorter. This reduced sunlight can disrupt our body's internal clock, leading to feelings of depression, a hallmark of SAD. The shift in time can confuse our bodies, making us feel out of sync. Additionally, this lack of sunlight can cause a drop in serotonin, a neurotransmitter that affects mood. Lower levels of serotonin are associated with feelings of depression. The darkness of winter can also increase the body's production of melatonin, a hormone that promotes sleep, which can lead to feelings of lethargy and low energy. Understanding the science behind SAD can help us cope with it more effectively. There are scientifically proven ways to manage SAD and improve your mental health. Let's delve into some of these strategies. First up, light therapy. This approach involves exposure to artificial light during the darker months. Special light boxes mimic outdoor light and can help regulate your mood. It's a simple and effective method, but do remember it's not a one-size-fits-all solution. Next, we have psychotherapy, also known as talk therapy. Cognitive behavioral therapy, or CBT, can be particularly helpful for SAD. It's a process that helps you identify negative thought patterns and behaviors, then replace them with healthier, more positive ones. In the case of SAD, CBT often focuses on challenging thoughts related to the darker seasons and finding ways to engage in activities you enjoy, even when it's cold and gloomy outside. Medication is another option. Selective serotonin reuptake inhibitors, or SSRIs, are commonly used to treat SAD. They work by balancing the levels of serotonin, a neurotransmitter that affects mood, in your brain. However, like all medicines, they come with potential side effects, so it's essential to discuss these with a healthcare provider. And then there are lifestyle changes. Regular exercise can boost your mood by increasing the production of endorphins, your body's natural mood lifters. A healthy diet, rich in fruits, vegetables, lean proteins, and whole grains, can also help manage SAD symptoms. And let's not forget the importance of getting plenty of sunlight. Even a short walk outside on a sunny winter day can make a significant difference. Lastly, don't neglect the power of a good night's sleep. Quality sleep is crucial for maintaining mental health and can help manage the symptoms of SAD. Try to establish a regular sleep schedule and create a restful environment to encourage better sleep. These strategies can be effective, but it's always essential to remember that everyone's experience with SAD is unique, and what works for one person may not work for another. Remember, it's vital to consult with a healthcare provider before starting any treatment regimen. Battling SAD alone can be tough, but you don't have to. When the winter blues hit hard, it's crucial to remember that you're not alone. There's a whole community out there, both online and offline, ready to lend an ear, share experiences, and offer advice. Social support is like a warm blanket on a cold winter's day. It wraps you up in understanding and empathy, providing a comforting buffer against the chill of SAD. That's why it's so important to reach out. It could be a trusted friend who always knows how to make you laugh, a family member who's there for you no matter what, or a mental health professional who can provide you with expert guidance. You see, managing SAD isn't just about the strategies you adopt, it's also about the people you surround yourself with. So don't hesitate to seek support. Share your feelings, your fears, and your hopes. Remember, seeking help is a sign of strength, not weakness. Let's quickly revisit the important points we've discussed today. We started our journey by understanding what seasonal affective disorder, or SAD, really is. It's a type of depression that comes and goes with the seasons, typically starting in the late fall and early winter and going away during the spring and summer. It's important to remember that SAD isn't a case of the winter blues that you have to tough out on your own. It's a real and serious disorder that can and should be treated. We then delved into the science behind SAD. We learned that shorter days and less sunlight during winter can mess with your biological clock that controls your sleep-wake patterns, and with your serotonin levels, a neurotransmitter that affects mood. Your melatonin levels can also be disrupted, which play a role in sleep patterns and mood. Our journey continued as we explored the proven strategies to manage SAD. Light therapy, psychotherapy, and medication are the main treatments. Light therapy involves sitting near a special lamp so that you're exposed to bright light within the first hour of waking up each day. Psychotherapy, specifically cognitive behavioral therapy, can help you identify and change negative thought patterns and behaviors that may be making you feel worse. And medication, such as selective serotonin reuptake inhibitors, can be effective in treating SAD. The importance of seeking support can't be overstated. It's okay to ask for help. Reach out to your loved ones, share how you're feeling. You're not alone in this, and there are people who want to help. In conclusion, SAD is a serious condition that requires attention and care. There are effective treatments and strategies available, and seeking help is not only okay, it's encouraged. Remember, it's your mental health, and you're worth the effort it takes to keep it in check. Take care of your mental health because you matter. Reach out to a professional if you're struggling with seasonal affective disorder, and remember, you're not alone.